I don't have to use these things very often, so we'll see how they work. Thank you. I'm also here so I have a straight way out the door if you start throwing things. Because I do have a role here. I am the official old person. No other role. Oh, no, this is official. No, I was told. There's sort of four things that I'd like to do. The first is sort of where am I on the spectrum of old people? Because there are things I know and there are a whole lot of things I don't know. Obviously have opinions about a lot of them, and we'll try to give you a quick summary and try to lead you into things please ask questions about. So I'd like to do that both sort of personal a little bit more and sort of my health situation. Then I'd like to give sort of one example of what frustrates me every day, and then a complementary what really makes me happy every day in the area of health literacy. And then sort of close going back to me, the patient, because it was already mentioned, me, the patient, is changing. And so everything I say has changed from yesterday, but that's okay. So given that, let me get started because otherwise we'll never get done. So personal circumstances. Family influence has been very important. Why? Number one, I'm an only child, so I don't have to either worry about or seek family caregivers because there are none. The cousins that I have are Chicago West, so they aren't really close to be able to do any kind of really day-to-day kind of thing. And my parents also, while they had family, we grew up in Michigan. My father was from Chicago, my mother Boston. So they lived and grew old away from their family. So they also had no caregivers close by. I was out here at the time. So one of the things that I was taught and learned was the value and the need for independence. To make no assumption anybody was going to take care of you. You needed to be able to take care of yourself. And that is something that I still have in my head and still try to practice. One piece of that in taking care of yourself was dealing with the importance of health care and insurance. And so that was one part of being independent. The second part was my parents getting old. How did they take care of themselves? Because they were each other's caregivers. And they wanted, like many seniors, to age in place, which is what I'm trying to do. This was in the mid-90s. Independent and assisted living facilities were only getting started. And so what they were involved in programs on the Agency for Aging in Jackson, Michigan. They were active in the community. They, in essence, looked at what was available for what cost or for what kind of demographic, what could they get to allow them to stay in their home. They then also looked both in that area, and I even there's one in the Washington area in Chevy Chase that was just opening, and they were visiting, so we went to visit that independent assisted living facility to see what would you get there that you couldn't get that you might need. They concluded they could get enough, and their illnesses were such that, in fact, they both were able to stay in their home, and we're happy for that. So that helped me understand the village movement when it showed up. They were just 20 years ahead of the time. I also have a broad base of experience, and the value of that has been, since I've seen a lot of things, done a lot of things, I like to think that I'm a little bit more open when something weird shows up. As was mentioned, I'm a civil engineer, back from before there was STEM. My work experience, I spent about half of it as an engineer. What I like are the engineering skills, the analysis, the planning, all of that kind of stuff. But the second half of my career was absolutely non-technical. I came out to work in international development, mostly organizational development. How did I learn that? From the previous 20 years. Living options, places, and types. I've lived in small towns, town of 400, mid-sized towns and growing up. And, now I live in urban areas. I lived internationally, lived in Senegal for about 3 years. So a little bit of everything. As a kid and once as an adult, I lived in houses in a number of locations, mostly in the Midwest. And ever since, I've lived in apartments and like it. I right now live in downtown Silver Spring, which is just sort of 20 minutes up the road, right by Metro. That's why I live there, because I can get to everything, or could get to everything on Metro, not need a car, et cetera, et cetera. Health basics. Always had insurance, even when it was tough, because even 20 years ago when I decided to be an independent consultant, but I had I already had a pre-existing condition, so getting insurance wasn't easy. I was able to become a semi-business, whatever, a sole proprietor, so that I could get Maryland insurance, because otherwise it was too expensive or not available to me. While I'm on Medicare and supplemental insurance now, I consider myself generally healthy. I'm generally healthy, but I have cancer. Gut cancer, uterine cancer in 1996, radiation after 20 years, great health. Except when I look back for this, about 2000, and since then, I have spinal stenosis, neuropathy, non-diabetic, but that's sort of why the primary reason I have the walker. Have some osteoporosis. Anybody wants to know about osteoporosis medication, I think I've tried all of them. They've had various effects. And then glaucoma. I don't consider those problems. They just are sort of out there. But 2016 is when I found out that there was another problem. I got colon cancer, they think caused by radiation. We went through surgery and some pill-based chemotherapy. 2016, thought everything was solved. About 2 months into 2017, we found not right. It's come back. So I'm now on an infusion-based chemotherapy for a sort of non-operable cancer, and that's all fine. But I'm learning a whole lot. So the last 2 years is what I'd now like to focus on, since I'm talking too much. Currently, medical professionals, just what are you doing? I have 9 doctors, my primary and the rest specialists and their staff, plus testing and support services that I am dealing with right now. Happy to go into details. I look back at the last 4 months, and I've averaged 7 or 8 visits, even trying to consolidate some things, a month. So that's 1 or 2 a week. And I think I'm basically healthy, and I'm trying to do some other things. That's a lot of time spending in the healthcare system. So I'm just going to try to give you good and bad from what I've learned the last 2 years. And I'm going to focus really right now on the healthcare system and clinical staff, because you see I spend a lot of time with them. But I'll mention a couple of other things. Hospital system and support organizations probably been my biggest frustration, because that's also in some ways the most nebulous. But I've learned a lot. Some doctors, who knew, work at hospitals, but they are not part of the hospital system, and everybody now is part of a hospital system. They have some privileges, but not all. And the one that was important to me did not have access to hospital records. We had to work around that. So lots of confusion, difficult to communicate, duplication of effort. The other thing, and this has been true ever since there are computers, my name is Mary Ann. It's 2 words, it's my first name. No one agrees. So I got into the hospital system, among other places, as about 3 different people. And initially, there were 3 different people and they weren't connected. And so we had to connect me. Found out there are a lot of M.A. Zimmermans in the Washington area, so it was my birth date. We now have me as a number. I am the same number in the system. My name changes. We don't care. I know when I was born. They know my number. We're cool. Support organizations. They're different within the same system, like visiting nurse groups are not the same at 2 different hospitals within the system I'm in. What's been a bigger issue is there was a new medical supplier that that bought out the one that had been providing really good service on infusion supplies. And that caused the whole system to change around how I get infusion when I go home, because I'm on a system. I go for several hours at an infusion center, go home and carry the medicine for another 46 hours. And so I need a visiting nurse, and I need some supplies. And everything changed in the course of about a week when they found the group had bought the other people. Nothing was going to be the same. The hospital and the group didn't really talk to each other. The new group insists on delivering supplies at my house, at my apartment. What do I need them for? They're medical supplies. Well, you're supposed to have everything done at home. No, I get sick when I have to wait another X number of hours and take another half day waiting for the 46 hours up. So we're finding ways around it, but it has been very frustrating. Electronic systems and portals are part of that because they're variable and multiple. Access can be tempered by, my ability to use it and provide good information and find the password. But then also the physician and patient having the same information, because they change systems get upgraded. There are different people that put information in, including myself. Correcting errors can be really difficult. There's a staff member that enters information. I enter information. The doctor enters information. Somehow or another, they often aren't the same, or they go different places. How do you get them the same? Doctor to doctor, we've mentioned. So my backup is I have hard copies of everything. So I have a big stack, but I can bring with me to a doctor what they might want. And at least I have it in a couple file drawers at this point. The other side of it is the clinical staff, but I want to say something that I hope we can come back to. Family and community is almost as important as some of this other stuff. The Silver Spring Village that Scott mentioned, if you don't know about that movement, I'm happy to talk about it because they do have medical note-taking, which was critical, and it was from the start of my finding out about cancer 2 years ago. And then there are a lot of social activities and educational activities that they have. But I have my Cheers location where I go eat or get within 2 blocks of where I live. People know your name, you get talking. You learn a lot besides just the support you get. My apartment community, old folks help old folks. And young folks are actually nice and have things to offer also. Relatives, extended family, some extended family are in the area. They help as they can. But the clinical staff has been the lifesaver in all this because they have helped me work through roadblocks, all these things that I've talked about. My primary care physician has ended up serving as my second opinion because his personality, my personality, he's been able to lead me to the right kind of places and help me make decisions. The specialists, do you know who's who or what they can do for you? Mine get high grades. They're very open with me and others. I can tell you all the kinds of people they are because some of them may be the doctors, physician assistant or other kind of technical staff. There's also this social worker that is at the infusion center. How do they help? I have 4 questions that I finally concluded I used in answering that. How well do the doctors, their staff, communicate internally with other doctors and with the patient? Second, how well do they explain things as well as do things and follow up? Can they find 5 extra minutes when something isn't working right to help get it through, or do you have to set another appointment? How easy are they to contact? It's great, but if you have to wait a half hour on the phone, you're probably not going to do whatever it is. And lastly, what's the culture of their institution and the attitude of their supervisors to work with the patients and their goals? All of us that are in institutions know there are cultures, and it can really make a difference in what then those within the culture will do. Me, the patient, always me. But okay, I'm sick. I just told you I don't think I am, but I am. And I am seeing over the last 2 years how my level of energy has changed. And while I think I can do things now if I go do something take a 20-minute rest, go eat something, go do something, and you get into a pattern. And it's working okay, but that's certainly not how I lived 2 years ago. I don't have the family link easily available to work through things. I have some perceived, and I see real limits on what extended family can actually do. It's taken me a while, but I've sort of also figured out these same kinds of things are probably and actually true where there's real family involved. But it took me a while to figure that out. It's easy to get overwhelmed. I like to think my brain is usually functioning, and it's certainly there. But there's way too much information. The TMI that gets used for all sorts of other things. In healthcare, it is there. You can be literate, and you go crazy trying to read it and figure out what it is. Because much of it is undifferentiated. The same thing we have in the world, we have in health information. I can look on Google and get any answer I want to my question. And a few times I've chosen carefully. Often it's hard to access and find a second time, and to be able to provide and keep the information in order. I mean, this providing information when you get asked the same question every time you go in, even though you've already provided it. I don't remember what my parents died of 25 years ago. I still get asked that question. It's been recorded. I'm not always able to keep positive, which I know you find hard to believe, but I do yell and scream, and hopefully people out in the hall of my apartment building don't hear me, at least once a day. This is where undifferentiated information is good. I found an article that says yelling and screaming to get out stress is a good thing. That's justified my behavior. I do understand and try to be positive, say hello, smile, say thank you, because I have more energy. It's nicer for everybody. I get a lot more done and really enjoy the day. 80% of the time it's that. The rest isn't. I've got a minute left, so we will just say there's a continued need for a purpose. At least I think all of us do, to go on. Or when do you reach the point where I've had the good life and it's okay? Intellectually, I understand that, have all the basics in place, and every time I get a twinge, I said, is this it? Not yet, please. I'm, theory, practice, they don't quite match. So that's basically it. And, sort of with that, overall, I'm good. I don't know if you get good or bad out of all this, but I'm really good. I am independent, and boy, do I say it like that, because friends remind me, independent, but the definition changes. I can walk 2 blocks. I will drive a mile. That's a whole lot different than what I used to do, but I'm independent at this point. And the other part that's just as important is I have people throughout, friends, health, whatever, that I trust to go to and who seem to understand how I define living. And that's why I'm good. Thank you.